The meeting of the Alexander County Board of Social Services is now called to order. At this time, I would like to ask Phil Iker to give the invocation, please.
Our Heavenly Father, we thank you for all the blessings you've bestowed upon our lives, dear God. You thank you, dear God, for watching over us, dear God. We pray that you'll be with us in this meeting. Dear God, we pray for the ones that we serve them with love and compassion. Dear God, thank you for the dedicated staff that we have to take care of these folks. Bless this meeting, we ask in thy name. Amen.
Amen. Everyone has a copy of the agenda. Do I hear a motion to approve today's agenda?
Make a motion to approve it.
Second.
I'll second.
It has been moved in second. Everyone has a copy of the minute from December the 18th, 2012. Do I hear a motion to approve the minutes?
I'll make the motion.
Second.
I'll second
It's been moved in second. We will now hear, Sherry Deal will now present the December financial report.
Good afternoon. Happy wet afternoon, I should say. What you have in front of you is for the month of December, and we're officially halfway through our fiscal year. Just a couple of items I'm going to make mention of. The top category for expenditures, for the most part, all of our expenditure categories are below where we currently are in the fiscal year, except for just a few. The ones I want to point out, one is daycare, and we are overspending a little bit there. However, our revenues that we're bringing in are matching that percentage. And towards the end of the year, I think, if I'm not mistaken, Trina may know, but I think we may get a little bit more money. I'm not sure. Either way, the spending will level out towards the end of the year. Another category is under general assistance. It's showing that we're at 67%. Excuse me. And that is due to two different allocations that we have. One is our crisis intervention monies. We got an initial allocation of $122,000, and we have spent roughly $111,000 of that. So that's elevated our percentage a little higher. However, we did get another allocation back in December that raised that level to $206,000. And at this time, the budget amendment has been prepared and given to finance. However, it's not reflected in these numbers. Down at the bottom, one thing I want to mention, the housing and home improvement funds. It appears that we've not received any revenues. However, we did report some expenses back in the month of December for November expenses. However, we didn't get reimbursed for that until January 2nd. So we do have some monies that have come in. They're just not reflected here. And probably the last thing, I'll just bring your, make some notes down here at the bottom. We've currently spent year-to-date $877,000, which translates into a little over $146,000 spent each month. And currently, based on what we have left, we could spend up to $174,000. So right now we are below budget. However, as the year progresses, our allocations start running out. So even though we are in good shape right now, and hopefully will continue to be, the numbers will kind of subside from that picture. And I'll be glad to take any questions. Okay.
Thank you.
Thank you.
At this time, we will have the introduction of a new staff member.
Good afternoon.
Good afternoon.
This is James Sturgill, and he's a social work student at Appalachian State. He's doing an internship with us. He'll be working with Child Protective Services 32 hours a week. And you hear us talking about pre-service and how important that is to us, because you have to have that before you can do any work with families or any of the children in Child Protective Services. And as a part of being a student at Appalachian, he's already had that. So we can start giving him cases and different things as soon as we feel and he feels comfortable with the agency and the community and things. So we're excited, very excited. I think he's excited too. So, thank you.
Welcome aboard.
Welcome.
Yes.
We'll give you a real internship experience.
We will now hear the highlights of the statistical report from DSS supervisors.
Well, good afternoon. I'm Holly Young, the Children's Services Program Manager. If I can draw your attention to page 5 of the statistical report, that is where you'll find the Children's Services data. You can see that we received 66 reports in the month of December and accepted 47 reports for investigation. On the last day of the month, we had 47 investigations open, and we had 34 in-home family services cases open on the last day of the month. We also served 90 children in the month of December. Dropping down to the foster care section of that data, we did have a child to enter custody in the month of December, bringing our total number of children in care to 46. And that number will increase again in the month of January as we have taken custody of some more children this month. We have 3 children currently that are legally free for adoption, and 9 children that are being supervised in adoptive placements. And we also have Tennille Heilman, who is our adoptions and foster home licensing worker. Those are just a couple of her job duties. Is expected to go out on maternity leave within the next month, and she is working very diligently to complete some adoptions, but also to complete some foster home licensing from a class that finished up late in this past, in 2012. And so right now you'll see that we are supervising 19 licensed foster homes that are licensed by our agency, but Tennille is working diligently to get 3 or 4 more homes licensed before she actually goes out on maternity leave. And so hopefully that will happen, but if not, we'll do our best to get those folks licensed even without Tennille at the office. And so she's really been working hard to get those things done. And if you'll look on the Children's Services Investigative and Family Assessment Monthly Report, and I apologize, I noticed a typographical error on that just as soon as I printed it out. I apologize for that. You can just see the breakdown of reports that we received in the month of December, with the total number of reports being 47. The highlights of that report on page 1, the majority of those reports were taken as family assessments, 83%, and 77% of those were responded to within 72 hours, and 13% or 6 of the cases required an immediate response. On average, with immediate response cases, I've noticed that we have typically at least one of those a week, which during working hours requiring staff to immediately stop what they're doing and going out to respond to a family. It's not unusual for us to have those on call when things happen after hours, but we are seeing that we're having that happen more and more during the week when staff are needed during regular working hours to go out and resolve situations or assist with situations. And if you'll look on page 2 or the back side of that paper document, just to highlight some of the big numbers, you'll see 19 of the reports that we screened in, or 40%, were because of improper care. 16 of the reports, or 34%, involved improper supervision of children. 30 reports involved in injurious environment, that's 64%. And we've talked before about the different categories of injurious environment. That can mean lots of things. Unsanitary conditions in the home, domestic violence, substance abuse, all fall in that category. So that captures sometimes multiple things. And then when you look at our substance abuse, which is the number that we really have focused on a lot lately, is there were 18 reports or 18 cases involving substance abuse issues, or 38% of the cases that we were involved in. And only one case that actually involved both domestic violence and substance abuse during the month of December. And I'll be glad to answer any questions that you may have.
The 3 children who are freed for adoption, is there someone actively pursuing their adoption of those children?
Those children are all placed in their prospective adoptive homes.
And the reason I asked, I had a young couple ask me about social services one time, and if they wanted to become adoptive parents, contact your office?
Contact the agency and we'll get some information from them. They would first have to become licensed as foster parents, and we would encourage them to foster before they actually adopt. There are private agencies that will actually work with folks to do private adoptions, and you don't have to go through that process. But we cannot place children that we have custody of in unlicensed homes for the purposes of adoption unless it's a kinship type arrangement. So, yes, contacting Tennille or Carrie Head or myself at 632-1080, and we'd be more than happy to talk with them about that process.
Okay.
Any other questions?
No, go ahead.
Thank you.
Thank you. Okay, our program today will be Challenging in 2013, presented by Cindy Holman.
Come down here where I can talk to you from the podium and look at you while I'm talking. Obviously, I took the information that I'm about to give you from the experts, and they are in the room. So if they have anything to add, I would welcome them to do so. We just wanted to talk with you a little bit today about 2013, a new year, some new challenges that we have, and make sure that you as our board know what those challenges will be for this year. Hello.
How you?
Good to see you.
Probably threw my hat in.
One of the first things I wanted to talk about today was, of course, our new automated system. We've been talking to you a little bit about that as we've gone. It's NC Fast for the food and nutrition services will be coming on. Behind that will be Medicaid, and then will be child welfare that will be entering this new automated system. It has its challenges. I know that's surprising to you, and we've talked about that a little bit before. There were 2 phases for our county, soft launch and hard launch, which soft launch meant that we would be able to take new applications in the system, and then behind that will be hard launch when everything will convert into that new system. We do that next Tuesday. So we will ask you to think about us next Tuesday when we go into that. We have had our share, just like any other county has. There have been lots of little glitches and issues, as there are with any new system that you adopt. You can only imagine, with all the millions of rules and regulations about the Food Nutrition Services Program and the Medicaid program, which will be a bigger bear, I think, how much has to go into that system for it to accurately, because really a lot of our job is, you do still have to have knowledge about the programs, but a lot of our job is to make sure we accurately put into this system all of that information that we gather so that the system can then determine eligibility. We will be coming to you and talking about purchasing some scanners, very possibly. document management is in the scope of NC-FAST, and we will need scanners when our clients come in and they bring information. Obviously, if we're going to an automated system, we don't want to also have a great big paper file where we've put all the information. So we will be talking with you at some point about scanners. We're not there yet, but we're starting to hear and receive some information about exactly the specs and that kind of thing. And I keep looking back at Matthew because he is the expert at this point. We are looking for some part-time help to help us with our transition. We are hearing from other counties that it is almost impossible for just the staff to be able to, there are so many problems when you first start. We have heard from our neighbor, Catawba, that they're not at the end of the tunnel. They were a pilot county, and that I think they are beginning to come out on the other end of that huge challenge. But as we enter that, we have had our staff working late in the afternoons. We've had them working Saturday mornings. Do you have a question, Darryl?
Yeah, how long has Catawba County been working on it?
May of 2012. So we're going a little faster than they did. However, they were the guinea pig. They really took on all the challenges. So we are going to benefit from a lot of the lessons learned from those pilot counties. As I mentioned, we are looking for some part-time help. It is our understanding that just the conversion of the cases into this new system is the most difficult piece. It's not so difficult, but it's time-consuming. And so an estimate that's been given to us is 2 hours per case. So if you look at your statistical report in front of you, you see how many hours and hours and hours that would mean in order for us to convert those cases. So we will be using our clerical staff to help us. We will be using hopefully, we'll be using some part-time help. We're trying to recruit from some of our neighboring counties that have some experience. So we'll be adding some help around this issue. A big training learning curve for our staff. And in the meantime, while we've been trying to learn and convert to this new system, the applications are still pouring in. So even though we're trying to make a conversion, we don't stop what we do every single day and taking brand new applications that walk in the door. Our hope is that in time that we will cut down on some of the recipients who don't turn in or don't do whatever they're supposed to do, and their case gets terminated, and then they come back in next month and reapply. That is really a waste of resources and really people's time, our clients' time. So we're hoping that this system and different techniques that we might apply to that situation would help us with that problem. So that's NC-FAST. Anything else that you can think of, Matthew, that you'd like to say? Another challenge for the new coming year is Medicaid transportation. You've heard us talk a little bit about that this year. Our transportation problems all the way around. We began providing gas vouchers as a backup system to what we already had, and what we already had was Greenway. We would make all of our referrals, Medicaid referrals, to Greenway Transportation Authority, and behind Greenway, there was no other system. So if they could not do a trip on a particular day or didn't have a route going in that direction, people would either have to reschedule their appointments or figure something out or not go. So we did start doing gas vouchers in April of 2012, and as an additional option, we're required to offer Medicaid transport service as a part of our Medicaid services to the county. We're required to do transportation. And because of the extensive amount of paperwork and scheduling, we had to pull one of our economic services positions completely to do Medicaid transportation. And what that meant was work first cases and family and children Medicaid cases. There had to be some rescheduling and reconfiguring within that unit, and a position had to be pulled out. And I don't think I've ever come to you and said, we're overstaffed, we've got an extra position. So We're go- So it did, it made those caseloads higher, and it has been difficult. We are planning to do more transportation in the coming year, and I'll talk to you a little bit about that a little bit later. We have had some situations, I think I've mentioned to most of you, that we could not fit in some folks who were referrals, appropriate referrals for our congregate feeding sites. We could not get them on the Greenway routes that are existing. And there were not additional vans or drivers or whatever kind of resource through Greenway to get those folks. So we have some people we're not serving, and that grieves us terribly to know that there are people out there that are needing to get to those nutrition sites. So we'll be doing some more transportation in the coming year.
Cindy,
Yes, sir.
on that issue, do most rural counties have the same problem we're having?
I will tell you that Greenway serves Burke, Catawba,
Caldwell,
and
McDowell.
Caldwell, and
Yeah.
all of them are having problems with
No, I'm
not
talking
enough
about
service.
small rural counties that are not in Greenway's jurisdiction.
Yes,
I can't, Greenway, I understand, they run great big empty buses, but if other rural counties are having the same problem, this came about because the federal government decided that it made sense to regionalize transportation. And smaller counties, I think, are suffering for it. If other counties are having the same problem, then DHHS should be putting the information together to present a case so that we either go back to the way we used to do it, or we get an improvement with where we are, because they run to the larger populations, but rural areas get hurt bad as far as Alexander County. And I would be willing to wager, especially if I win my bet with Matt, that every other rural county in North Carolina has the same problem. And rather than us working this, fix it here, we need to get everybody together and see if we can't address it across the state. Or that's an idea.
I absolutely agree with you, and you do, I'm sure you know that there is an RFP out right now for a brokerage system for Medicaid transportation, which is the big bear that we face. All of our Medicaid eligibles, those folks have a lower income, and they struggle with transportation. So there is an RFP out right now in North Carolina to have one broker for the state that would then operate transportation in all of the counties. I can't tell you where we are with that. The RFP is out there. I don't know how many places or how many companies have applied for that, but every time the directors come together, we talk about transportation, both general transportation and Medicaid transportation. But of course, general transportation does not fall under our purview.
We talk about it, but is
Right.
anybody doing anything about it?
Well, some of the counties feel like they do a really good job with transportation. And, some counties have local systems. Some of them have the regional systems. It depends on who you talk to, but transportation is a problem that comes up every time. I don't know I can't tell you exactly what other counties are doing, but I certainly am willing to gather. And are you, Darrell, are you focusing in on specifically on Medicaid and DSS transportation, or are you talking about transportation as a whole, general transportation included?
Well, first of all, since we're here today, it would be people who need transportation for health issues, for work, the things
Social
you've already
services.
outlined.
Right.
We have, and I'm as guilty as anybody would talk about it, but I don't know if the problem is Greenway, and I know Greenway's having their funding cut some more this fiscal year, but is the problem unique to our four-county area, or is it a statewide problem? If it's a unique problem to our four-county area, we have an issue we need to address here. If it's across the state, then the division should be loading some guns to say, hey, let's change this mess.
Well, I do think that the proposal, that is an effort Did you have
No,
some?
when you get through.
Oh, okay. I think the RFP that has been released is an effort to, on their part, to try and address. But I will tell, and I cannot speak, obviously, Darrell, to other counties. I know that Catawba County has a fleet of vans. The agency has a fleet of vans, and they do a lot of transportation themselves. I know transportation is a huge issue in Caldwell. Their cab company just closed down, so they are much like us. They have no cab services to rely on. Greenway cannot meet all of their needs. They are certainly trying. And we do, I mean, Greenway's the only show in town, so we don't want to undercut that. I had mentioned a minute ago that we're trying to do some things, and we are going to try. DSS is going to try to do more transportation. We simply cannot have people referred to the congregate meal sites, and we can't get them there. And some of them live within 2 miles, I think Julie had told me, of the feeding site, but they don't fit onto the routes that exist. So we are going to be doing some more transportation. We are going to be looking at the purchase of a couple of vans, and we are planning to. That has not been put forward. That's not official yet. Obviously, Darrell, you may have some say-so in that, but we are proposing to do more transportation, not to undercut what's already going on through Greenway, but as a supplement. They'll be our first call that we'll make to see if they can do that transportation, because as you said, their funding's been cut. We don't want to lose that as a resource, but to supplement that. So I don't know that I've really answered your question about other places, but I certainly can get some information about other rural counties. And yes, I do hear that, though, when I go to the directors' meetings, that they are struggling with transportation.
Well, the whole thing came down, though, from, I think, from the federal with funding for regions rather than the counties. And it goes back to the same question about the computer system. There's 50 states in this United States, and do they have a program that's working right anywhere? And when the computer question was asked, Matt said no. Still not sure we have 50 that are, any of the 50 that are working. And they do the same thing with transportation. And it bothers me when we got people that don't get an answer. But we'll find out.
My question was, if I was a recipient of Medicaid, got a voucher, once they get the voucher, is their responsibility to find the driver or
It
something?
is. The voucher is given to the individual who is Medicaid eligible, and then it is up to them. They either drive themselves, pay for it through their own vehicle, or it is up to them to make
find
their
themselves.
arrangements, yes. And I have mentioned to you, talking about challenges for the coming year, and I've mentioned this, I'll just mention it again briefly, that if healthcare reform comes through, and we have no reason to believe at this point that it will not, that it will bring us many more Medicaid eligible folks in our community. They will be income eligible. And so we do anticipate an influx of applications if that happens. Another economic program that we've had some issues with, and Darrell here again, we have SEEK, which is a child care program. It's an automated child care. Now at the daycares, there's a little machine installed at each one of them, and each parent has a little card, and they swipe their card when they come in the morning, and they swipe their card in the afternoon when they pick their child up. And that system calculates their payment, what the provider is eligible for in payment. And that has been another bear for us. We continue to work on it. I think Phase 2 was supposed to roll out it's probably been 6 months ago now, and it still has not rolled. They are still talking about it, and I'm sure that it is going to roll, but they have not worked out all of the bugs in that system. So that is something we'll be facing in the immediate coming year. And each of these things I'm talking about are things that in 2013 are going to affect us as an agency. Adult programs. Julie gave me a a pretty lengthy list. There's been lots of changes in eligibility. Many of our facility residents are no longer going to be eligible for personal care services, and they're going to be reevaluated, which means that if they are not eligible and they're in a facility, it's the loss of a funding source for that person in that facility. Certainly could affect whether facilities will take that person in, or whether they'll keep them, if we lose those services. We are diligently looking at any other kind of service, Medicaid at risk and those kinds of things, that those persons might be able to be eligible for. We have not, at this point, had anyone displaced from a facility, but that is a challenge that's coming up in the next year. Our adult care homes are being looked at across the state for being, or whether or not they're IMDs, which are institutions of mental disease. And if there are, they came and reviewed us at one point in this community, looked at some of our facilities. If they determine that our facilities are an IMD, an institution of mental disease, if they have too many people in the facility that their primary diagnosis is mental illness, then that facility would lose all of their Medicaid funding. So we are diligently making sure that our facilities know about this and that they're monitoring the population that they are caring for and that kind of thing. Some communities have already had facilities to be notified that they are IMD facilities. So that would have repercussions. Where would we place the people coming out of a facility? We do not have an overabundance of housing in our community. We continue to maintain waiting lists for most of our home and community care block grant funded services, which means elderly and disabled persons in our community are waiting for in-home aid. They may be waiting for housing and home improvement, to be at the nutrition sites or the home-delivered meal routes. So this is always concerning to us. We're seeing more individuals placed due to the lack of family support in the home. So we're seeing some of our older and disabled folks, more of them placed. We have a new automated system. That's what you're going to hear from now on. ECAP-C, it's a CAP Community Alternatives Program system, and I'm told that it takes longer to complete the assessment and upload it into the system. So on the back end, I'm sure that all of these automated systems will be good for us. It's just the beginning of them is really difficult for our staff because it takes more time in the beginning. We have a new and different appeal process for CAP DA and CAP Choice. We already talked about sufficient transportation, and we are receiving an increased number of adult protective services referrals where the client is mentally ill. And as you can imagine, that makes the cases more complex and the more time-consuming to work through the issues in those cases. So we have to feel like that's about access to services. And those are the adult challenges in the coming year that we wanted to mention to you. In Child and Family Services, any questions or anything, comments? In Child and Family Services, I've been telling you about new staff forever. We looked at our numbers again today. We have 2 senior managers with 13 years experience, 1 social worker with 8 years, 2 supervisors with 7 years, 2 social workers with 4 years, 1 social worker with 2 years, and 10 social workers with less than 2 years. 6 of those have less than a year. So as you think about Child Protective Services in the coming year, we are going to be in recovery. That's all I can think of to call it, for a good while. It will take us time because it is complex. Families, every individual family is different. The dynamics in my family and yours is really different. In order for us to accurately assess what's going on, find out who can be the protective, who can protect in that home, we have to give good attention to those cases. and with staff that need so much training. There is pre-service requirement, but behind that, there are so many other requirements. Our staff are required to go to 24 hours a year after their first year, each year of training for each individual. It's stressful to the management staff. We have high caseloads, and they're earning comp time that they can't take because we can't afford to have them out. So I just want you to be aware of that and thoughtful about those folks in that area. We continue to have concerns about access to mental health services in our community. We are working with more cases where substance abuse and mental health are the primary issues, and we have to wonder if the public in general is having trouble with access to services, and that is then equating to more reports for us. We are having a difficult time recruiting and retaining foster parents in the community. Placements cost more if we're not able to put children with family or agency foster homes. If we have to go with a private business that is licensed to do therapeutic foster home, those kinds of things, it costs us a whole lot more than it does to place with our foster homes. So we need foster homes, and to those folks that are watching this meeting today, I would say if you're interested, please call our agency. As far as the budget, just like last year, we'll be trying to predict a lot of unknowns when we are in our budget process this year. Fiscally managing the changes that are coming at us, the Medicaid transportation, the FNS system, the part-time help we've had to add on, those are not things that we could predict or budget for last year. Our high caseloads in every area, even our attorney. If you think about Rob, when I came 2 years ago, we had 30 children in foster care, I think 29. And now we have 46 as of, I think, the report today. We have actually a couple more, correct, Holly? How many we have now? 49 children in custody. So when you take an attorney that's got to be in court trying to take care of 30 cases versus 49 in juvenile court, and then also he does our child support court. So every workload at every level, including the managers, has been bumped up dramatically. And then we've had a plague this year of sick leave, surgeries, those kinds of things. Shelley, bless her heart, she's been on the front desk. She's done every job in the agency, I believe, trying to cover us through those. And, folks certainly cannot help that. The flu has taken a bite out of us. So that all sounds negative. The positive things are that we have wonderful staff. We have hired some wonderful staff. We're really excited about the hires we've made this last year. We do hope to get stabilized as far as, and it's like saying quiet, isn't it? Holly always tells me on the weekend, I'll always say to them, have a good weekend, I hope it's quiet. And she'll say, don't say that Q word. It's not, stabilize is probably another word we shouldn't say, but we do hope, we have good staff. We hope we can hang on to them and have a lot to do this coming year, and you'll be right there with us working hard. Any questions? Anything else about?
I think you did a great job of explaining.
Thank you.
Thank you. I always jokingly say this, Holly, did I overlook anyone? Because I always go past her when she's getting ready to go up, so you don't have anything else for today, do you? Uh-huh. Okay. I always. I noticed that, yes. Okay. Are there any items from the board at this time? Okay, the next meeting of the Alexander County Board of Service will be February the 19th, 2013 at 4 o'clock. And at this time, the board will enter into closed session in accordance with our general statute.